There's nothing like having your patients run down the hall and jump into your arms, or the teenagers who are pretty grouchy and brighten up when you walk in the door. They're just amazing, and it's just an incredible feeling to be a part of this journey with them. I am specifically a solid tumor doctor and the director of the survivorship program, or the STAR program at Lurie Children's. That means that I see patients in clinic, and I see both survivors of pediatric cancer who are 5 years from diagnosis or 2 years post-stem cell transplant, and also young people who are diagnosed with an acute cancer, generally a solid tumor, meaning not leukemia or lymphoma, but any other tumor that you can have. And so I take care of people from the time of diagnosis to really the time of a young adulthood as survivors, when I transfer them to the Adult STAR program. I think the proximity to Northwestern, to all of the science, particularly as an oncologist, to the research that's happening right down here, to the ability to collaborate with our adult counterparts, which for me as a specialist in adolescent and young adults is particularly important, because we can share protocols and we can discuss in conferences these particular patients and really collaborate to make sure that we are doing the best medicine we can possibly do for people. You have to understand the medicine behind hematology oncology, so understand the biology of the tumors and understand the different protocols that we put people on and the ways in which chemotherapy can affect the body and the different treatments that we use, whether it's chemotherapy, radiation therapy, or surgery. But I think almost as important is that human aspect of things in terms of how you relate to kids and their families at these horrible times, the compassion that you can show children, young adults, and their families, the way in which you can give people hope that things are going to be better, and also the confidence to say, I know what's going on, I have a plan to take care of what's going on, and no matter what happens, I'm going to be on your team to walk you through all stages of this journey. I am so happy to be a physician. I can't imagine doing anything else.